My name is Dr. Eric Salud. I am a general dentist. And what I love about dentistry is a few things. First, how life transforming it can be. Being able to give patients confidence again when they weren't able to smile before and now they're able to smile. And having patients that are able to chew again, with patients not being able to eat whatever they want, being able to allow them to chew the foods they want is a great feeling. And lastly, it's taking that patient that is so scared of the dentist and is so afraid to come in, providing them such a great experience that they're willing to come in for they're willing to come back to see us on a regular basis. What makes implants the gold standard for replacing missing teeth are that it's the closest thing to replacing a natural teeth as possible. The implant replaces the root of the tooth. So once we're able to put a crown on that implant, you're able to chew naturally. And the tooth looks like it fits right in with the rest of the teeth. So you're able to chew as much as you want with the implant, and it's meant to last you a long time. Well, traditional dentures, they sit on the gums of your teeth, or they sit in the gums of your mouth, and they tend to move around quite a bit, and you're not able to chew as much as you used to be able to. With implant supported dentures, the dentures rest on the implants. They actually snap onto implants, thus stabilizing them, and you're able to chew a lot more of the food that you weren't able to chew before. And the dentures don't move as much at all. So it's a total game changer when it comes to replacing missing teeth. Implant dentures are quite easy to take care of. With proper brushing of the implants and soaking of the dentures, you're able to maintain the implant dentures for a long time. Well, with the advent of 3D imaging, we are able to take a three-dimensional picture of your mouth and determine exactly where we're going to place the implants. So we know where we can place them precisely and accurately. With 3D imaging, we are able to take an image of your whole mouth and look at it three-dimensionally so that we can accurately place the implants in the proper spots and knowing exactly what we're going to be working with before we even work in your mouth. So it leads to much more predictable results and better results. Well, the most common concern is pain. How much is this going to hurt? And what I tell patients is that with proper planning, with the right technology, the implant process is very straightforward. The pain is very minimal, and most patients, they either go to work that same day or go back to work the next day. And typically, the pain afterwards isn't very much. The process begins with a consultation. At that appointment, we will take a 3D image of your mouth and determine if you're a good candidate or not for implants. If we find that you are and you're good and healthy, we can place the implant. And then once the implant is placed into the bone, it has to heal for a few months. Once that healing process is over, then we start the process of putting a tooth onto that implant. And that process is very straightforward and typically does not need any surgical intervention for that. Typically, whenever you lose a tooth, what ends up happening is you end up losing bone and your bone starts to resorb and teeth tend to shift and your face tends to shrink in. So what implants do, they prevent you from losing more bone, they prevent teeth from shifting, and they keep your face symmetrical so that it doesn't look like you have a sunken face. Your face is sunken in. First step is to set up a consultation. At that consultation, we will take a 3D image of your mouth and determine if you are a good candidate for implants or not. Um, and at that point, we'll review your health history and review your goals to see where you want to go moving forward. and we'll come up with a plan that works for both of us. So if it's the implants, then we will definitely look at placing implants that day.